Okay, we're going to do a ankle taping, so a lateral ankle taping if you've got for a medial injury. You can use the fat hyperfix as a way to speed up your underlay. If the patient's going to have this on for like 2 days, it's best to hyperfix it because it's a lot more comfy. Can you do it? So once again, pull both off at the same time. Try not to get increases. And then just one layer there will do. And if you can just turn off it, relax. And that's a quick way to hyperfix if you've got the fat one. And it covers most of the ankle and it makes it a lot more comfortable for the patient. So what we're going to do, imagine this is a really acute fat ankle. A little trick that you can do is use something called Leukofoam. You put these in the ankle gutters where the malleoli are, especially when you're taping an acute ankle. And what you'll find it does is it helps push out all the swelling out of these gutters, which is what you want to do for initial management. So you cut this, cut it to shape approximately, and then curve it around. And it's got double-sided tape on the back, so do that. And just, you can do C-flex again for me. That there, and then you put one on the other side. Obviously it makes your initial ankle taping really fat, but it creates a lot of support. It helps a lot with compressing the swelling. And you'll find a big difference when the person comes in after having that rather than leaving it, just letting it swell. Okay, so with an ankle taping, there's a few areas that you want to make sure that you don't cut into. First one is the base of the 5th metatarsal, so your tape should never come right at the base of it because it will cut in. Also where the tendon is here, make sure that you're not cutting straight across, and the Achilles. Alright, so this is your anchor. As you can see from the anchor, it just gets put on in a not straight cylindrical fashion. Make sure that it's not too tight. Anything coming straight across, make sure you're not doing it too tight. So because we're thinking this is a lateral ankle injury, we're going to aim for the posterior half of the medial malleoli first. So anchor, then up and pull. Make sure that your patient is dorsiflex the whole time. Keep reminding them because they always drop out of that position. Now you're going to overlap by half and pulling up laterally, locking it in. So they're your stirrups. This is your figure 6. So you can either start from the center, come across, and meet it. So that's one figure 6, and then you can come on a different angle with your next figure 6. So straight down, and you can come across. Making sure no creases. So that's a figure 6. And then you can go figure 8 or heel lock. So this is where you start. You can start either, I like to start from one end. Always remember to cross behind the Achilles, but don't cut into the Achilles. With all the padding and stuff, that should be okay. So you're thinking about locking your heel in, coming back up, and you can end up the ankle. Making sure that everything ends so that when the anchor goes on, you've covered everything. No random bits sticking out. And then now I like to do a double heel lock, so opposite side, coming across behind the Achilles, around the heel, and either back up to finish where you started or you can go up that way, either or. Anchor off. Once again, no stretch. No creases. Comfortable.
Yep.
And that's your ankle taping.